Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Cheryl Lynn with us here today, and Cheryl Lynn has been suffering for the last couple of years as a result of car accident, soft tissue injuries throughout her entire spine and her skull, and she's really got chronic pain now with a great deal of forward head posture, and she's starting to develop a little dowager's hump right up here, and she's had some numbness and tingling down in her pelvis and legs, so we're going to be looking at all that today, along with a little acid reflux as well. So let's take a look in the mirror first. Let's have you flex your head forward and then backwards for me, please, Cheryl. So her posture has actually improved considerably since the first day that we started seeing her. But this year, how many treatments is this? 9. 9 as of today, yep. So she's still got a little bit of forward head posture. And she's translated a little bit to the right on the x-axis in her cervical spine, making her left shoulder a little higher. Pelvis is also translated to the right of center. She got big number 28, is it?
82.
82. I'm looking in the mirror backwards, so. Number 82. What player is that?
That's the year I was born.
Oh, that's the year she was born. That's even better. That's a good number to have. Okay, they don't have numbers that high for Renee and I. Okay, let's go on your
That
back.
low.
Oh, yeah.
The year is low.
Yeah, the year would be a lot younger. Yeah. I don't think they make 110. Okay. Well, that's a good thing. It means you're losing weight. So we bring her legs up parallel. See, that's not as high as a lot of people's, but that's parallel for her. So we're going to wrap this around her chin and her occiput. Take a nice deep breath in. Let it all out. Oh, yeah, good. Feel that all the way down?
Yeah.
Okay, good. Get these out of here. So we decompressed her entire spine, and we're having to break up some fibrotic adhesions in and around the, there we go. I know I'm not supposed to talk while I'm doing the popping, so all you crack addicts can hear everything.
I heard it.
Yeah, I know you heard it deep inside. But fibrotic adhesions start forming in and around the actual joints of the spine. Let's go up here with your tummy back. So the best way to break those up is through this manual spinal decompression and just plain adjusting of the spine from the cervical all the way down. Yep, just like that. So her legs are even today. That's a good start, and they stay even. That tightens up in your little back though, huh?
Yes.
So she does have bilateral sacroiliac subluxations, and I think you can tell that was a little tender to touch on her. And they're also a little tender when I adjust them too, because they've been in a pain cycle for a long time now. She has what's called chronic pain at this point. And many people who have been involved in automobile accidents will get past their 3 months and get into a chronic pain syndrome. So we do everything we can at this point in time to increase her mobility throughout her entire spine and pelvis. There we go. Good. As well as when we make the adjustment, it creates a proprioceptive neurological bombardment, which resets all of her joint angles and also trips the pain gate, which is a mechanism that the body has and sets up that creates this neurological pathway of pain from the muscles to the corresponding viscera or vertebral levels. when it gets really bad, start developing trigger points throughout the body. A lot of people have those multiple trigger points throughout their entire body and that's fibromyalgia. It's fibrotic scar tissue formation, and usually chronic fatigue syndrome is associated with that, as well as a lot of depression in many cases with chronic pain, because people have been hurt for so long that it affects the chemicals in their brain, serotonin levels. We don't prescribe any medications for that, but oftentimes refer out to pain management doctors for that. Right now we're just improving her circulation throughout her spine and pelvis, which will help to bring oxygen and nutrition into the cells and help the vasculature carry out the metabolic waste products of normal cellular metabolism. So we have Sherilyn drinking a lot of water all the time. She's good with that, but you can tell she's sore all throughout these muscles in her legs, all the way down to her calves. So we would classify her as sore all over. Okay. You stand even. This should feel a little easier than the first one.
Yeah.
Okay, good. Okay, let's turn you on your back now. Now, since we're dealing with the hiatal hernia here, so too, we're going to also pull that down today. Take a nice deep breath in, let it all the way out. And so I'm going to go right under the rib cage and grab the top of the stomach, the fundus, and pull it straight down, which is not too bad today, actually. Another one. I know it's a little tender still. There we go. Keep exhaling. Good. And one more time. There we go. 82. You know, by 82, I'd already graduated from Palmer College of Chiropractic and been practicing for a year. You just being born. Taking care of a baby here. There we go. You should have felt that all the way up into your pelvis, did you?
Yes.
Okay, good. Let's sit you up sideways and we'll face towards Renee there. Good.
I'm really trying to stay quiet.
You know, well, you gotta try harder. There we go. There we go. I keep thinking back, we're gonna have to bring us in a big screen TV that's got a video of St. Thomas on it, so we can be like we're adjusting in St. Thomas in the tropics. And back here in Houston, it's been cold, damp, wet weather.
Yes.
Okay, so let's come over here and shoot you now. So she's moving a little bit better after that. Okay. So let's flex you forward and backwards again. Good smooth range of motion. She's a little bit translated still, so we're going to have her pull these shoulders up and back, clear these guys way back here, and then we're going to bring her head way back in the Z-axis here and translate it a little bit to the left. You'll feel a little tap on her atlas right there on the right, and now on the left, and we're going to reset her trapezius and levator scapula muscle spindles right here. There we go. Okay, now let's try that same thing one more time. This should feel a little smoother than the previous one. Yep, see how her head came back on that one? So much better. You feel like you're standing up straighter now? You got equal distance down here. Very good. So Sherilyn, would you mind sharing with our YouTube subscribers what brought you in here in the first place, and you've been receiving treatment previous to coming here.
Let's see. I've had about almost 2 years of treatment in February, but we came here because you do the actual
Decompression, yeah.
That's helped.
Did you find this on YouTube?
Well, I used to work for Newfield. So
Oh, that's right.
yes.
She worked for Newfield in the building here, oil and gas company.
So
Yeah.
I saw you when I wasn't injured.
Okay,
long
that's
time
right.
ago.
I remember that now.
Yes.
Yeah.
But I mean, I went to you now,
Mhm.
and I mean, the lower back has been helping. It's been helping me out a lot. That's the number one place that it doesn't go away.
Is the care here different from the other
It
chiropractors
is.
that you've been
It is.
seeing?
It's
In what way would you tell people?
Well, I don't get twisted as much.
Right. And that feels better on your low back, right? More stable.
Yeah.
Yeah. Good.
And of course the decompression, which
Right.
helps immensely.
That is true.
I mean, I get a longer.
That's my
length of
favorite
relief.
adjustment. Not only to do, but to have
Yeah.
done on myself.
You would never think that.
Yeah.
went
Well, this is the reason people fly over here from Saudi Arabia and Australia and UK, everywhere really, and hiatal hernia treatment.
Yes.
So this is your Houston chiropractor, Dr. Gregory Johnson and Cheryl Lynn, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.